Hey guys, I'm Rahul and I'm a co-founder of Paradigm alongside my friend and colleague Sahil. Together we created Paradigm to prepare you for change. At Paradigm, we aim to educate you on topics that are essential yet neglected in school and university. These are topics that are essential when you make a transition to the real world. And this podcast is available on Spotify, SoundCloud, and YouTube. Check our Instagram page out, which is at Paradigm Education, for more updates regarding Paradigm. And today I'm alongside Sneha, who's a specialist in the topic we'll be discussing today of health, and she's also a senior partner at Paradigm.
Hi guys, my name is Sneha and I'm a senior partner with Paradigm. Like Rahel said, I mainly focus on topics regarding health and well-being, and I'm currently a high school student in year 12. Today, we will be discussing the importance of being knowledgeable and trained in first aid skills with our guests Aarzoo, Bhatia, and Ananya Singh.
So guys, if you could go ahead and introduce yourselves, that'd be great.
Hi everyone, I'm Ananya. I'm a fourth year medical student and I study at the University of Liverpool.
Hi, my name is Aarzoo. I'm also a fourth year medical student and I also study at the University of Liverpool.
Okay, so you both said that you're studying at the University of Liverpool. So tell us about your course and how you're enjoying it, and describe your course a little bit.
Okay, so our course is 5 years long. We do 2 years of preclinical testimonies, and after that, the last 3 years are mainly focused on going into hospital and clinic and to the GP to learn practical knowledge and how to do clinical procedures and take histories. And based on that, we also do some more lectures and small group teaching, but mainly focused on placements. And I'm really enjoying the course. It gets hectic and long, but it's what I like doing and what I love studying. So I've really enjoyed it so far, and I've loved the course structure.
Yeah, I think I agree with Aarzoo on pretty much everything, and I think placement especially is very nice because you can put everything that you've learned in the past 2 years into practice, and you actually end up remembering it better when you actually see it in practice. And on top of that, interacting with other doctors or other students, nurses, and even patients is like a really nice feeling, and it kind of reinforces, yes, this is why I joined medical school. So that's been a really positive thing about it.
That's great, guys. So what I wanted to ask you both was, were you always certain about medicine, or was there other career professions that you were contemplating between?
Me first? Yeah. So for me, yeah, I've always wanted to be a doctor since I was 4. That's very cheesy, true for me because my grandfather was a doctor, and in fact, he treats his patients for free. Even now, he's 70 plus, and he still works 8-9 hours a day. So he was kind of my inspiration for this, and yeah, I was kind of always on the path to becoming a doctor, and then everything fell into place eventually with some hard work. So yeah.
Yeah, so I also have a similar story because from a young age, when I was 5 or 6, I also wanted to be a doctor. And along the way, I really started loving biology, chemistry, so everything just came into place. In the middle, in year 12, I was thinking of other courses like pharmacy, but I guess they were also very related to medicine, and I thought that if I'm doing medicine, I'll get to know a lot about pharmacy anyways. So pharmaceuticals, I mean. So yeah, I just went for medicine.
So both of you you're both studying in the UK. So was that always your plan, to study medicine? Did you always want to go to the UK in comparison to other countries, or were you interested in other places as well?
So basically, I was staying in India until I was in year 9 or so. So it was always my plan to go to India and do medical school because that's what I knew about. Only when I came into year 12, halfway, I even considered the UK as a possibility because I realized how much the competition is in India. But still, going to India was my main focus, but I didn't get in over there, but I got in over here. So I came here.
Yeah, for me, I think it was a bit different because I did most of my high school in Singapore, and I think I kind of always had a plan that maybe I'd be in Singapore, but it was a very tough application process, and also hadn't really considered where else I could go. So in 11th, 12th grade, I actually started considering and applying to lots of places. So I applied to Australia and I applied to India and like all sorts of different places. But I think eventually the UK was where I was more attracted to. So that's how it ended up happening.
Yeah, so like currently I'm a senior and Sneha's a junior as well, and like we're getting to that like whole process of uni and all of that, and I'm sure like it was stressful for you guys as well, and it was just like a time you sort of wanted to get over with. But what I wanted to ask you guys, which is a topic that we're focusing on today, but also a topic that's quite relevant, like towards all of us, is hygiene. So, living as a student, like in the UK especially, there are a lot of times where you're sharing spaces with other people because you'll either live in dorms or other form of accommodations or in labs. So, considering the whole, pandemic, um, where should we be placing more of an emphasis on health, safety, and hygiene? And like, do you guys have any tips you'd give to people going to college about that sort of stuff?
I think one of the big parts of it is where you're touching, where you're putting your hand. So surfaces get dirty very easily, and I think it's even more relevant now. But I think a lot of people, they don't really think too much, like exchanging money and then touching the doors, eating their food, not washing their hands in between. And I think that's something that's quite important, even for normal infections, but even more so for COVID. So like washing your hands or even sanitizing them between anything. So if you shake hands with someone or a couple of people, and just sanitizing them afterwards, or if you're coming from outside, as soon as you get home, washing your hands. That's the main important thing, I would say.
Yeah. And even like small things like just going to the grocery store downstairs or something, it's still important to come back and make sure that you don't give anything to the people who are living with you. So I think you just have to be very considerate about everyone around you, and likewise they will also be concerned about you.
Also, one more thing in addition to that. So I don't know if a lot of people do it, but definitely in my family, and now that I've come here, washing your groceries or at least keeping them somewhere where you don't touch them for 2 days is also probably gonna help you maintain hygiene and more importantly prevent any sort of infection. So it's another thing. But yeah, at the end of the day, you gotta think about more than yourself, especially because it's a pandemic. It involves not just you but everyone else around you. So you've got more of a responsibility towards others as well. And especially because that's if you end up becoming a doctor or even as a normal member of society, that's important that you think about other people as well as yourself. So yeah.
Yeah, we're a bit scared because we're just gonna start placement from Monday, like in 2 days' time, and we know like all clinical areas are high risk areas, and we're living in a flat of 4 people. All 4 of us are going to a different hospital, so that's like a lot of risk. So yeah, so we have to come back every day and wash our clothes and take a shower, wash our hair every day. So that's gonna be a lot of things to consider, but it's for the safety of everyone.
So obviously, like you guys were talking about with your course specifically, because you're doing medicine, there's additional risks. Like you said, you're going to all these hospitals and stuff, but just in general as well, living as a student in Liverpool or in the UK in general, what do you think, like, firstly, like obviously you guys were considering the student life and what it would be like when you made the decision to go to the UK. So how do you think the student life in the UK, like specifically, like the activities that people are generally doing that are not necessarily related to medicine, how do you think that they should, like those people should take precautions to avoid, spreading disease or to maintain health, etc.?
I think it's pretty much along the same lines. Of course, for us, we need to take extra precautions, but it's the same thing, maintaining hand hygiene, or maybe at least being aware of the places that you're visiting, perhaps the people that you're visiting, things like that. But I'd say it's pretty much the same. And obviously nowadays, wearing a mask when you're going inside shops or even outside, because that's very important. But I think it's along the same lines, really.
Yeah, and whichever university you go to, they are giving everyone some guidelines of, what the local coronavirus scene like, and what all they can do to be cautious. So you should like listen to those and keep those in mind as well.
Yeah, and I think especially nowadays, as much as everyone wants to have a nice social life, it's going to be a bit harder.
Yeah.
And there are restrictions on the number of people that can meet up. So if
Yeah.
you kind of keep that in mind for just the next couple of months, then hopefully we're able to ride this out without another wave or any other serious complications. And I think that's something that just applies to the whole population, really.
We're all used to like meeting up in big groups and societies or like a whole course party or something. But obviously, like you should take priority of like safety and health and hygiene before all of that.
Right, like I really couldn't agree with you guys more. And another topic that Sneha and I wanted to talk to you guys about was first aid. Now, first aid is also something that's quite neglected, and how valuable do you think it is to be knowledgeable about first aid? Because usually it's just something that parents take care of, and like you sort of brush aside most of the times. But now that you're living independently in uni, it's probably a different case.
Yeah, I think that's very relevant because all of us end up getting little cuts and scratches, and usually our parents are there, like, oh, yeah, I'll just dress this wound and stuff. But I think first aid is very important for anyone and everyone to know because it's basically the first interaction that you have with the wound, the first thing that you do with the wound, and that can later on help prevent serious complications like infection and stuff like that if you've got like a cut. But yeah, first aid is very important for everyone to know, I think.
Yeah, yeah, for sure.
And oh, sorry, were you saying something?
So I was also saying first aid in the other sense, like if you have to give someone CPR or someone's choking or they have a life-threatening complication right in front of you. So that's also very important to know, especially if there's no one else. Potentially, you could be the difference between the person living and dying. So it's also very important to not freak out and know exactly what you need to do. And for that, I think like when you're in the actual scene like that, you do like start freaking out. You do forget everything that you need to do. So it's very important to do that same practice over and over again, so you can make sense of it still.
And so you guys are medical students, and so have they taught you about first aid in university itself? And so they might be teaching you first aid in university, but like, do you think they teach it in other courses, or is it just for you guys?
So I think this is something that's more specific to us, but there are also a lot of first aid courses that happen in Freshers Week that I think people can apply for and stuff like that. But as of now, it's only for people doing medicine and maybe similar degrees to medicine.
Yeah, I think all the degrees that have like an outdoor component to it, like geography or something, where they need to go outside a lot and they can get hurt, or like any athletics or something, they also do first aid courses because they're like the more high risk ones. But I'm not sure about the others.
Right,
And
and sorry, go ahead.
What would you say about like the depth of your first aid courses? Like, do you think that as a medical student you would feel prepared to kind of deal with an emergency situation on your own?
Yeah, definitely. I think they make sure that we keep our skills up to date every year.
Yeah.
And because we've also seen it put into practice while we're on placement, and we've kind of helped with that as well sometimes. So it's definitely something that if we were alone, then we would know how to deal with it. And obviously, if it makes a difference between someone's life and death, that's a great thing that you can do.
Yeah, and I think reinforcement like helps a lot. So if you go through the same guidelines every 6 months, every year, it doesn't matter as long as you know the basic principles, like you can help out someone anyway. So the depth we do it at, like it keeps increasing every year of medical school. So in first year we learn the basics, second year even more than that. So the more we reinforce it, testing we do of ourselves, practice we do, it helps out.
Right, and is there like a certain memory or an experience you guys can recall where you first learned about first aid?
I think I learned it when I was in 11th grade. So I just applied for the CPR course and it was in Singapore. And I didn't really come across this here in the UK, but they had these models that you had to practice CPR on. and it was very specific. So they had sensors inside. They were testing how much pressure you put and how often you do it, the timing and stuff like that. So doing it on those mannequins was actually really hard because they could actually tell how you do on a real person. That was kind of scary, but I think, yeah, that was something I remember because when I came here and I actually did it on a mannequin without any sensors and stuff, it seemed much easier. But yeah.
I also I just saw a Facebook ad when I was in 11th grade to do a first aid course for high schoolers. So I just joined that with some of my classmates and we all did it together.
So you guys were a little bit older when you did your first aid course for the first time, but would you recommend younger kids also like start doing courses like these? Like when would you recommend people start learning about first aid?
I think any age is good because no one will choose like who's gonna be in front of someone when they get hurt or if they're about to die. So even for little kids, like at least if they know like the signs of what's happening, check if someone's breathing or not, they will know at least to call the ambulance or call someone nearby who can help them. And when I was doing this, my brother was also in 8th grade and he also did a course which was a bit simpler. But I think he also learned a lot, and they had courses for even younger kids, like as young as 4th or 5th grade. So there's no correct age to start. Like anything you can tell a kid also will potentially help someone else.
Yeah, especially kids nowadays are so much more smart and responsible, everything better than us. So really, as soon as you can get them started on it, the better, because they are very aware of themselves and the society around them. So they can make a difference, really.
And can you guys think of certain experiences that you found, that because you were aware of like first aid and how to deal with it, like a specific experience where some of your friends or someone in need was injured or required first aid help, and you guys recalled either helping them or like a situation where maybe it wasn't you or someone close to you or someone else?
I don't specifically remember something that I did as of now, but definitely back when we were in first year, I think someone on our course was out with a couple of friends, and then he saw someone choking over there, and then he actually applied like first aid to them, gave them the back thrust maneuver and stuff like that, and he ended up saving that person from choking. So I think that was something that definitely stood out because we just learned it like 2-3 weeks before then, and he had to put it into practice so soon. So that was definitely quite nice to see.
Yeah, I also haven't used like first aid myself on someone like outside of hospital, in the sense that like saving their life or something. But like smaller things like choking, which happens more commonly, is something I've seen other people help out people, or I also help out someone.
Yeah, and the very basic ones like dressing wounds, you do it for your friends and stuff all the time. So.
Yeah.
Well, so we mentioned before that, when it comes to first aid and first aid knowledge, often before you go off on your own, like before you go to college or whatever, you don't know much because your parents are kind of taking care of it and your parents have these like first aid kits or whatever at your house. So what would you recommend people that are going to college or going to live alone kind of keep in their houses as kind of a basic first aid kit? Like what would you say people should have around?
So there's quite a lot of things that you can keep that are important. So first of all, like any clean dressing, gauze and plasters and bandages that you can keep for yourself at home or your friends, and like safety pins, scissors and tape to help you dress wounds. Tweezers are also good for splinters. She just needed one like 3 days ago.
Yeah.
And a thermometer or any like simple fever medicine like paracetamol, or for pain also paracetamol works. So things like that you can keep at home. Anything else you can think of?
No, I think that's pretty much covered most of it, but maybe like some skin creams if you've got like an itch or something, and antiseptic creams. I think some people use like Dettol, Betadine, very basic things, but they go a long way.
Yeah.
So, guys, thank you so much for explaining these like really important yet like neglected topics, like including hygiene, first aid, and what to do when creating your first like basic first aid kit. And I think these are topics that people should know more about, and I'm sure you guys agree as well. So, thank you for briefing us on this, and we hope our viewers as well, maybe just like if you check out our Instagram, you can also learn a bit more about this from this podcast as well. So thank you so much, guys, for agreeing to do this, and we hope you have a great day.
Thank
Thank
you.
you. See you.